So I had my appointment today with my oncologist, and we have come to a plan about what we're going to do for endocrine therapy. Well, what I'm going to do for endocrine therapy. So originally, when I spoke to my surgeon, when I first found out that I had breast cancer, the tumor was very, very small. It was 10 millimeter tumor, so it's like a centimeter. And then there was also some DCIS around it. And the plan was just bilateral mastectomy, tamoxifen, go on my way. But then everything changed when I had my surgery and they did the biopsy and they took the sentinel node biopsy as well. So rather than just doing the tamoxifen for 10 years, excuse me, the plan now is to be on what's called an aromatase inhibitor. So she also threw out a couple other medications that she was thinking of using. One is called like a chemo pill. I talked about this last time. And then also an aromatase inhibitor and Leuperon, or just the tamoxifen. Now, my understanding from like how she sounded on the phone was that she thinks that my cancer was a little bit too aggressive, and my risk factor is too high to just be on the tamoxifen. So that's off the table. I told her that I cannot do a chemo pill for 2 years. So that's off the table. So the only other option is the aromatase inhibitor. So we are going to plan to do that. I have to read more about it and figure out, what kind of foods to avoid. And they're looking into the supplements and everything. So another part of that too is we have to figure out whether or not I am still premenopausal. Because if I am premenopausal, then they'll have to add what's called Leuperon on top of it to just shut down my ovaries. Chemo has put me into somewhat of a medical menopause right now, so I have to wait a couple weeks to see if that's permanent. Oh, my dogs are whining in the back. Sorry. So yeah, that's the plan right now. I meet with my radiation oncologist on Wednesday and find out what the plan is with them. So yeah, that seems like everything is going as planned, and I'll update you guys then. Bye.